Hi, I'm Paul Morton with MAdvisor. If you own a medical clinic or a medical practice and you have partners, you should consider a buy-sell agreement. What a buy-sell agreement is an agreement between partners, and that agreement determines what happens to the shares of ownership should something happen to one or more of the partners. So there are two primary types of buy-sell agreements. The first and most common one is the cross-purchase agreement, and this is going to be an agreement between partners directly. And then the second type is called an entity purchase buy-sell agreement. And this is going to be an agreement between the partners and the medical clinic. So before the buy-sell agreement is created, trigger events for what triggers the obligation to purchase the shares of each partner should be discussed. Common trigger events include death, disability, disagreement, even divorce, and departure or retirement. And while the buy-sell agreement is being formed, and even after it's formed, then funding mechanisms should be discussed and planned. And some of the most common funding mechanisms are savings from the business and cash flow that that the medical clinic generates. Could be going out and getting loans to purchase shares from the other physicians. Having insurance policies in place would be viable for a funding mechanism, and also negotiating an installment sale to purchase shares from the soon to be or the ex-partner of the clinic. So the funding mechanism would be discussed and planned in advance and would be any combination of these. So if something happens to Dr. Jane, she retires. So that is a trigger event. Dr. Jane, then, whatever funding mechanisms are prearranged for Dr. Jane and Dr. John, her retirement would trigger some sort of funding mechanism. And so then Dr. John receives some amount of funds. It could be funds from the business, it could be taking on a loan and funds from that, whatever it may be. So Dr. John receives the funding directly, and because of the buy-sell agreement, he then has the obligation to use those funds to purchase Dr. Jane's share of the business. Now, with Dr. Jane no longer being a partner, Dr. John receives more profits because Dr. Jane's not a partner anymore. So Dr. John is then paying Dr. Jane so that Dr. Jane can retire. And she has a ready market for sale of the business, and vice versa if the trigger event happened with Dr. John. And so that cross-purchase agreement is made directly between these two partners. The other type is the entity purchase agreement. And the entity purchase agreement is between the entity or the medical clinic and each individual doctor. So there are multiple agreements then, especially if there are multiple partners. And so if the same thing happens, Dr. Jane retires or has some other trigger event, then that funding is going to go to the clinic, not to Dr. John. It's going to go to the clinic, and then the clinic is going to use those funds to buy out Dr. Jane. And so then Dr. John, in either situation, Dr. John now becomes 100% owner, and he can continue the medical practice to serve the community, and he may want to find a replacement someday for Dr. Jane and create this same buy-sell agreement again with the new physician so that When he retires or something happens to him, then the medical clinic can continue serving the community. So if you own a medical clinic and you have partners and you want to discuss your options, schedule a time to chat. Thank you for watching.